you. My dear friends, since yesterday we were, talking about the digital health and the technologies, which is very much, I can say that is now getting value because of the scenarios, the current scenarios, and all. So let's discuss the topic which is given to me, that is digital healthcare. Ma'am, my slides are visible. My dear friends, when we talk about the technologies in healthcare system, when we talk about the AI in healthcare delivery system, I think as a healthcare professionals, our main aim is what? Our main aim is we want to improve the patient care. And second one is that is to enhance the healthcare outcomes, to enhance the outcomes of patient care, right? But the best thing is when you will integrate all these advanced technologies into your practice, that helps you in achieving all those aims, that helps you in achieving all those goals which is set by you people only, right? Now, when we talk about the modern healthcare, so in modern healthcare, this environment, the healthcare delivery system is very complex, right? And if the healthcare professionals wants to achieve the goals, if as a healthcare professional you want to achieve the goal, it is very much required that we need to focus on patient centered care, the evidence based practice, and we want to deliver efficient health services to the individual. And for that, I think the digital healthcare, the advanced technologies has to be there when you're working in the environment, in the healthcare delivery system, right? Now, what are the technologies we are talking about? Like in modern healthcare, the technologies plays a vital role, right? Now, these are the technologies which are, I think everyone is aware about that. That is electronic health records, telemedicine, telehealth, mobile health, the wearable health devices, the robotics in healthcare, and virtual reality. My dear friends, I think everyone is aware about that. Now the robots are conducting the surgeries, right? So this is amazing thing which is happening in the healthcare delivery system. Now, what are the benefits of digital healthcare? Right now, the most important thing, which is very important, that is the accessibility of health records. See, for example, there are 4 5 members are there in your healthcare team. For example, if nurse is there, doctor is there, pharmacologist is there, then we have a physiotherapist, then we have a person, GDAs are there, right? So that means 4 5 members are there in the healthcare team, right? Now, the if you talk about the digital healthcare, that means the records, the healthcare records, it should be accessible to everybody. If everyone is aware about what are the care given to that particular patient, what are the side effects of these medications, what are the things needs to focus on that, that means you are able to provide a actual care to the person, right? Another thing, definitely, when you have a better system of maintaining the health records, when you are following the electronic health records, that means there is better communication among each and every healthcare team member, right? You know why? For example, the staff nurse, the doctors who are posted in the morning shift, right? And then another person, another healthcare professional, they will join in the evening shift. Then another healthcare professional, they will join in the night shift. So that means every person is well aware about what is happening with the patients, right? These are the medications which is given to the person. What are the injectables are given to the person, right? So for the better communication, I think the digital records plays a very, very, very important role, right? Now, the most important thing, there is reduction in errors. Here, I would like to share one example with you. I have seen, I don't want to take the name of any hospital, sorry, but I have seen that if you're, for example, if you forget to document anything in the patient records, right? That means the nurse or the doctor who is coming in the next shift, right? They might forget to give that particular injectable to the person, right? Then the doctor or the nurse who is coming in the night shift, Then suddenly they remember, oh my God, this injectable has to given to the person twice a day, right? But the nurse who is posted in the evening shift, or the nurse who is posted in the morning shift, or the doctor who is posted in the morning shift, they forget to focus on these injectables, right? So that means the chances of errors are very, very high. But when you talk about the electronic health records, that means each and everything is entered in the system. You have a software, so you will enter each and everything in that. So the errors, the cases of errors are reduced, right? So the digital health records, it helps in reduction the errors, the medication errors, right? Now, another thing, improved patient care. Yes, if you are well aware about your patient, if you are well aware about the services has to be provided to the person, if you are well aware about like what is happening with the person, what are the things needs to avoid it, what are the things needs to be care, even the dietitian has to understand the patient care, the importance of patient care. Obviously there is enhancement in the patient services, and patient will feel more comfortable in the digital environment, right? Now, if we talk about the remote monitoring, now, what is remote monitoring? Remote monitoring means you are, see, you are here and you are providing services to the person who is residing in the remote areas, right? So when that person is residing in the remote areas, that means that person is able to assess all the health services which is required, which is actually required, right? Here, I would like to share one example with you. I have gone to many areas, many centers where I have personally feel that there is inequitable distribution of health services because health services are not available everywhere, right? It might be some internet connectivity is internet issue is connectivity issue might be there. It might be possible like the patient is not able to reach out to the center because of n number of reasons, right? So if we talk about the digital healthcare, so as a healthcare professional, this is our responsibility to focus on remote monitoring to assess whether the services are available to those areas or not where it is actually required, right? Now, education and simulation, my dear friends, if we talk about the education and simulation, simulation means when you are creating a real scenarios in front of the your students, in front of the persons who are actually going to deal with the live patients, right? For example, I would like to share one example with you. See, for example, if you want to teach the students regarding the CPR, the basic CPR steps, right? How to revive the person, how to save the life of the person, right? So you have a CPR dummy with you. So in that particular CPR dummy, you are going to create the scenarios. You help the individuals to learn how to revive the person, how to help the person, how to save the life of the individual, right? So you will create that scenario where the person will actually learn how to give CPR and what are the steps of CPR, right? So it is very much required that every healthcare professional should understand the importance of digital healthcare and the importance of the importance of maintaining each and every step so that we can able to actually work in that complex healthcare delivery system, right? Now, see, it's very easy to talk about the digital healthcare, but the most important thing, my dear friends, that is challenges actually. N number of challenges are there. Like there is lack of technical skills. See, as for example, I'm not a technology person, so how to use that? How to cope up with that? So I don't know how to work on the software, how to enter the data. I don't know anything. So this is the biggest challenge, right? So for that we need a skilled person, we need to have a trained person. So training has to be organized so that the person can able to handle these challenges, right? Now, resistant to change. See, I have seen many healthcare professionals, They don't want to change themselves. They are stick to the previous things only. They said, we don't want to change ourselves. Why to work on the system? We don't know how to enter the things. We don't know how to make the cards. Why to work on the system? We are happy with the registers. We are happy to collect the data on our registers. Manual entry, they are actually focusing on the manual entries, right? We don't want to change ourselves. That is the biggest challenge, I'm telling you, right? Now, there is no internet connectivity. For example, I'm residing, my center is in that area where I'm having a internet connectivity issue. Now, what to do? How to work on the software, how to work on the system. This is the biggest challenge for a person, right? Now, I think, my dear friends, everyone will be agree with my point that when we talk about the patient safety, when we talk about the patient outcomes, there is one thing which is very much important, that is confidentiality, right? Whenever we go and collect the data, whenever we interact with the person, we always focus on one single thing, that is confidentiality. And we always make sure that we convey the same thing to the patient also. We will not share any of your things with any person. We'll make sure that we'll maintain the confidentiality of your data. But when we talk about the healthcare electronic health record system, that means every person, every healthcare team member is accessible to open that data, right? So where is data security? There is a question mark on data security. So that means any person can have access to open that data. They can reach out to that data. So there is a question mark on the data security, right? Now, workload and adaptation and increase screen system. Obviously, if I'm going to enter each and everything on the system, if I'm going to enter each and everything on the software, that means the whole day I have to sit there on the screen. The whole day I have to sit on the screen, and the whole day I have to be entered each and everything on the software, on the data. So my workload will increase, my screen time will also increase. So I think these are the biggest challenges. Now, as a healthcare professional, what is your role in digital healthcare? The most important thing. Leaders should have a leadership qualities. That person is capable enough to do innovation in the sector, in the healthcare sector, right? So I can understand the people who are working might be under me, the people who are working under you, they are resistant to change. But as a leader, it is very much important that we have to introduce this concept in a very innovative way. You have to introduce the concept of digital era, the digital health, in that way, so that the member who are working under your umbrella, they're ready to accept the challenges and they're ready to accept the innovations in health sector, right? Yes, telehealth services. It is very much important that we need to focus on the telehealth services. Now, I think the government organized setups, the government organizations, the private healthcare sectors, every person is now focusing on the telehealth because it's in need of an hour. It's required actually. So everybody has to focus on that. Now, if we talk about the patient education, my dear friends, there are n number of apps. There, for example, I'll share one example with you, Nikshay app, that is for the tuberculosis patient, right? The app includes everything. The data is related to tuberculosis, is everything in that app, Nikshay app. The person need to register in the app, that's it. Then the person will get each and every information, what to have, what not to have, how to take care, how to discard the sputum, right? So patient plays a very important role in taking care of their own health. And as a healthcare professional, my dear friends, motivate the patient, encourage the patient. We as a healthcare professional don't make the person depend on you. Don't make the person depend on others. Don't make the patient depend on their family members, right? The patient should not be a burden for the family members. So it's very much important that as a healthcare professional, you need to educate the person. These are the apps available. Kindly register in that, open that apps, and follow the guidelines which was written in that, right? Then monitor the patient carefully. whether the patient follows your guidelines or not, right? Whether the patient is able to take care of his or not, right? Adapt the technologies, follow the technologies, help others to adapt these new technologies, because this is a tech era, my dear friends. This is a technology era. No one can replace the healthcare professionals. AI never replace healthcare professional. AI never replace your touch, the way you communicate, your expressions, your body language. Nobody can replace you. But yes, technology will replace those people who are not going to adapt these technologies. So you have to be tech friendly, technology friendly, right? And as a leader, as a healthcare professionals, you should know how to handle, how to manage the data. So it is very much required that as a healthcare professionals, you have to enhance the concept of digital healthcare and learn the technologies and help your peer group members, help your other healthcare professionals to adapt these technologies, right? Now, what are the future trends? Now, I'm telling you one thing. It is very much required to educate the person, educate the new healthcare professionals, the new generation of healthcare professionals with simulation and virtual reality. You know what is virtual reality? Here, I would like to share one example with you. I don't know whether I have shared earlier or not. There is one hospital here in Gurgaon, and that hospital is basically focusing on the mother and child care only. So they have a lab, that is virtual reality lab, in their hospital. That virtual reality means, now what exactly virtual reality is. If we talk about the virtual reality, my dear friends, virtual reality means you have a headset. The person has to wear the headset and he will see the films. He or she is going to watch the movies in that, right? And he that this is the way when when you are diverting the person's mind. For example, the lady is admitted in the hospital with labor pains, right? And she is admitted there for the normal delivery. Now, what that hospital do? They have a half an hour or 40 minutes video. So what they will do? They will help the individual to they motivate the basically that particular lady who is in labor pain to wear the headset. So when she wear the headset, she forget about the pain and she's going to see the beautiful world which is just in front of her, and she's watching that video through virtual reality. She's watching a beautiful world where she can see a beautiful movie. That movie might be related to his or her child. That movie might be related to some romantic movie also, right? So when you are exposing the person to these virtual reality, he or she can forget his pain, right? So this is virtual reality. Now, if you talk about the personalized care, yes, when you are able to assess the patient's pain, when you are able to assess the patient's condition, when you are able to diagnose the person properly, then you can able to provide a personalized care to the person also, which enhances the patient outcome, which enhances the patient care also, right? Now, wearable health technologies. I think everyone is wearing a smart watch, right? We have iPhones with us. We have iPhone watches with us, right? There are so many bands are available where you can assess what is your heart rate, what is your status, right? How many steps you walk, right? So these are the things which is very much required to assess your health. But my dear friends, make sure if you are okay, but there is some deviation in your watch, right? So make sure you have to consult to the doctor immediately. It might be possible because of if your cells might be weak in your watch, and it will gives you a false reading. So whenever you feel there is some deviation in your watch, in your devices, immediately go and consult the doctor, right? Then we have a smart healthcare. You know what is smart healthcare? Smart healthcare means smart hospital with digital era, with digital healthcare world, with virtual realities, where patient forgets their pain, where the patient forgets their issues, and they are diverting their mind through that movies, through virtual reality movies, right? Now, If we talk about the digital nursing, the education, the digital competence, my dear friends, I think there is need to introduce this concept in the curriculum too, whether it is a nursing curriculum, whether it is a medical curriculum, whether it is a curriculum, ambiguous curriculum, whether it is a any curriculum where the AI, where the technology plays a very important role, right? So there is need to integrate this digital world, the knowledge of digital health in the curriculum, right? And there is need to focus on simulation learning. You know why? Because it enhances the individual's critical thinking, it enhances the individual's problem solving skills, right? And there is need to have a training in that. We need training because see, without training we are zero. Without training we are zero in digital, in this digital world. So I think every person needs training in digital era. Every person needs to understand the importance and should be well versed with these technologies so that we can focus on patient's care, right? Now comes to the conclusion. See, health technologies, it's not just about machines or software. It's the integration of science, innovations, and systems in delivering care, right? So when we talk about the nursing technology, the digital technology, it is transforming the nursing education and healthcare by improving the patient care, communication, and clinical decision making. So I think every person should be well versed with these things so that we can enhance the patient services, so that we can enhance, or I can say that we can focus on these digital era, right? Thank you. Thank you, my dear friends.